This podcast is produced by Concierge Medicine Today, LLC. All rights reserved. Concierge Medicine Today, or CMT, was founded in 2007 and serves as the industry's trade publication and annual medical conference organizer. Please note, the information shared on this podcast and across all CMT platforms is intended for general informational purposes only and may contain errors or omissions. Nothing in this podcast nor across CMT platforms constitutes medical, financial, legal, nor professional advice. CMT is not liable for any inaccuracies. CMT encourages listeners to conduct their own research and consult trusted advisors before taking any action based on the content presented. No mention, interview, or link should be considered an endorsement. This content is primarily intended for a healthcare audience and may not apply to all listeners. Thanks for tuning in.
Welcome back to the Docpreneur Leadership Podcast, where we talk about building better medical practices, better leadership, and better care models for your long game. Today, we're tackling a topic that's been floating around in healthcare for years, but is finally moving from research journals into real exam rooms: whole genome testing and precision prevention. My guest today is from MyOme, a company working with concierge and membership-based practices to integrate these insights into cardiometabolic risk, cancer screening — that's a mouthful, by the way — cancer screening strategies, pharmacogenomics, and long-term preventive care. Joining us today is Premal Shah. I apologize if I have pronounced that correctly. I'm a little tongue-tied today. He has a Ph.D. in molecular biophysics, and we're going to jump into all of this. He's going to help us separate what's practical, what's just hype, and what responsible implementation really looks like inside of a concierge medical practice, and maybe even your practice that might not be in the concierge world as well. So let's get into it. Thank you for being our guest today.
My pleasure to be here. Appreciate you having me.
So if I botched any of your introduction, I always kind of go back and say, well, our guest, how did you get into healthcare? Tell us a little bit about yourself so the guests kind of know where you're coming from.
Yeah, and just a quick correction. My name is Premal. I know it's hard. I've been dealing with it my whole life. So I appreciate at least giving it a shot. Look, like everyone, I'm a patient. As with everyone we work with at MyOme, or people who tend to be passionate about healthcare, usually have a story or have a personal connection that led them into what they do. It's no different from me. I grew up in a family, not surprisingly, a predominantly Indian family, and Indians are predisposed to various diseases that other ethnicities are not, whether it be diabetes, whether it be coronary artery disease, and that's exactly what I've experienced growing up. My dad had a heart attack at a relatively young age, at 50. Now he survived, and he's living his best life in his older years. But my uncle dropped dead at 50. My cousin dropped dead at 50. I'm going to be 50 in 2 months. And so this is real for me. And, our singular goal, and my singular goal, is that I want to put out products that someday might save somebody in my family's life. And that's what really got us to get going on MyOme and bring the power of genetics to the front.
Excuse me. So how did you get involved with MyOme? Like, what was the journey, the pathway towards that?
Yeah, and so my previous companies, also in healthcare, Applied Proteomics is a proteomics-based company that looked for cancer signals in blood early before some of the newer technology and the newer companies started doing that. My last company is a company called Citizen. It was acquired by Invitae. It was about digital health. It was about empowering patients with their own medical records, especially in rare disease areas and cancers. How can we take all that information that they have? How do we take unstructured notes? I joke, we were doing machine learning before it was cool to do machine learning, back in 2018, 2019. And so that's what led me to MyOme. So how did MyOme begin? MyOme began with a fundamental premise, right? That people still get sick from diseases we know how to prevent. And as a result, we're putting undue cost burden on the system while outcomes are not being improved. So healthcare today is overwhelmingly reactive, right? Largely because we haven't been using the most predictive information available, which is our genomes. And we're not doing it in a clinically meaningful way. So we set out to solve the problem of early, accurate risk prediction for both common and rare diseases using whole genome data. And the company's vision was and remains that if you could quantify risk precisely and do it in a way that's ethnically and clinically valid, providing polygenic risk scores. This is the impact of many genes and variants within the genome. Also providing single gene risk assessment. Also providing medication response. Everything off a single genome, we can actually have clinicians intervene earlier to either prevent or delay disease. And in that way, we predict that if even with 50% compliance across the board in the United States, we can save the US healthcare system north of $200 billion a year. And most importantly, improve outcomes and prevent people from getting disease. So that is the singular premise and remains the premise of MyOme.
Wow. I'm not a word of the year kind of guy, but I keep hearing, I was just telling a physician this yesterday, I keep hearing the word meaningful coming out in so many of my conversations. And we find that, similar to what you were talking about, there is a bit of uh, when you're a patient, we're bundling things together because the relationship is lacking in our healthcare space. So we're getting this piece of information from over here, we're getting this test over here. How are you helping to kind of take it from being, unbundled to relational, meaningful, actionable insights? What is, when it comes to, cardiometabolic disease and cancer risks, what are the most clinically actionable insights physicians are using today without turning this into, information overload for patients?
Yeah, and so I'll start by answering it two ways, which is what is the current standard when it comes to genomics implementation in the clinic, and what we're moving towards and we're pushing people towards to, especially your audience, which is engaging with us really rapidly. So today, genomics has been a loaded word because people would embark on a genomics program, whether it be at a system level or at an individual level, and let's say you sequence 100 people. Let's say when the costs for high, that could range in the order of 100,000, $200,000 just to sequence 100 people. Because people would look at just single gene analysis, you would return a result on maybe 7, maybe 8% of people. These are single gene conditions, like BRCA1, BRCA2 for cancers, FH, familial hypercholesterolemia, for our heart disease. And so you people would look back and go, the ROI simply isn't there. I'm spending this much money to identify 7 people out of 100 that I know something about, but what about the other 93 or 92 people? And I spent all this money. That's been the historical issue with genomics. And at the same time, the prices were high. So two things are happening now. I always like to say prices are coming down really fast. They've been coming down for a decade, but now we're at a point now where it's easily accessible. And at the same time, what we can learn out the genome is going up. So I call this eureka moment where the curves are crossing. So let me give you a perfect example. You asked about what a practical clinical implementation is. So I've talked about historically people focus on single gene analysis. And that's the impact. We use polygenic risk scores. And as we were talking about earlier, all PRS scores are not created equal. People download PRS scores, they slap a logo on it, and they call it a clinical score. That, in my opinion, is harmful. It's borderline malpractice. And so our development of our integrated risk models, we validated them across ancestries, including those of mixed ancestries, combined them with real world factors. And it was a big step forward in the industry. And let me give you a practical example. It's me. Okay. My dad had a heart attack at 50. As I mentioned, my uncle dropped dead, my cousin dropped dead. Now, if you plug in my risk scores, these are traditional scores that everyone measures every single time somebody goes to physical. So, it's a lipid panel, metabolic panels. You plug all those numbers in, and my doctor, she'll tell you I'm at probably 5 or 6% risk of, heart event over the next 10 years. And that's probably on the lower side of intermediate risk, probably low to intermediate in that range. But if you factor in my genetics, which obviously we've done with the MyOme integrated polygenic risk score for coronary artery disease, my number shoots above 20%.
Mm.
That's real. So that's why, I have conversations with my physicians. Should we go from a low dose statin to potentially a higher dose? I just got a CT angio last week and look at the soft plaque and looks like everything's good. There's one artery that's maybe a concern. We're just going to monitor it and make sure that that doesn't get too worse. So my blood pressure is normal, but it has been creeping up a little bit over the last couple of years. How do I start monitoring that? These are all things that are available to you. They're not esoteric modalities for screening. But knowing this, knowing that I have this issue, has propelled me to do that. Because the other answer is what's traditionally been done is 5 or 6% risk, diet and exercise.
Mhm.
And the reality of it is diet and exercise often leads to fatalities alone. We have medicines, we have screening modalities, let's use them. So that gives you a sense for how we're now implementing this in the real world and how your customers and even our customers are using our stores in real practice.
Uh, Rabbit trail question. We've got these new innovations in healthcare, and you have a unique seat on the bus and a unique seat on the driver's seat. Of the innovation that's out there, how much are physicians actually using? Like, that's a big picture question, and I know it's hard to answer, but I'm not a physician. I'm a patient. I know what it's like to sit on the other side of the exam room, the service window, and these things never come up, right? Like what you're talking about. I mean, I have them with my doctor because he's a special doctor, right? He's in this space.
Yep.
But at the same time, there's a lot of other patients who are not having these conversations. And we could get on to, it's the broken system that doesn't allow it. When that aside, that everybody knows that. Why aren't we getting more of these innovations out there, like what MyOme is doing?
Yeah, look, I'm not one of those people that's going to just throw my hands up and say, we're part of a messy, broken system, and therefore we can't do anything about it. I'm an optimist by general. I think you have to be to be what I do what I do, and sit in the seat that I sit in. But to answer your question, remember, you talk to medical students today, or you talk to doctors today, and they'll say they spent a month on genomics in medical school at a 4-year program. The education isn't there. You talk to physicians and they go back to the same problem I was alluding to earlier. Oh, genomics doesn't impact my population. What do I need to use that for? I've got all the information I need. I'm good. So there's a lot of education that needs to happen, and that's one of the things that at MyOme we really honed in on early. That and this is based on previous experience with other companies that I've run. That you have to meet the physician where they are. If you want to completely change their workflows, their thinking, that's an uphill battle. So what do I mean by that? What are practical things that we do? We provide genetic counseling for every test that's ordered. These are genetic counselors that will speak to patients and or physicians and explain to them pre-test and post-test. Why is this valuable for your patient? What are the results? What do they mean? That's number one. Number two is you have to explain reports and results in a clinically intuitive and meaningful way. We take great care in our reports and how we present the data. Genomics data, scientific data can be overwhelming, especially if you're looking at so much data on a daily basis. Give you a perfect example. Our coronary disease report is a single bar, and it shows the following: that if you just looked at your clinical factors, the traditional clinical factors that your physician would do, you would be here. And this would be your absolute 10-year risk, not relative risk or anything like that. This is your absolute risk. Now, now that we've incorporated genetics, here's where it moves. Sometimes it moves higher, sometimes it's protective and it moves lower. And there you go. That's your 10-year absolute risk. So your risk goes from 6% to 8%, 6% to 2%, 6% to 20%. It's very easy to digest because then they know what to do. Yes, let's get you started on high dose statin. And I'll give you a perfect example of this, if I may. We announced that we're part of the Catalyst program down in Alabama. And you would think to yourself, Alabama, right? That's an interesting place to do something innovative in healthcare. But the group that's administrating this program, Southern Research in Alabama, they saw that genomics, and specifically polygenic risk scores for common conditions that we put out, can be used as a way to engage people in primary care. There are so many people in Alabama who've gotten to adulthood beyond who don't engage with primary care. And that is a surefire recipe for encountering health issues. So how do you get people to engage with primary care? You do it in a responsible way, ethically validated way, given the history, especially down in Alabama. And you say, look, we're going to give your physicians with your personal risks And they're going to put together a personal plan for you that's not difficult. You got to swallow a pill every day. Maybe come in every 3, 4 years for an image. But that's it. And we're seeing massive uptake of this program there because it's all about making it easy, relatable.
Wow. Yeah, and in concierge practices, they compete on that relationship, trust, and the experience, and they are in competition somewhat, even though it's a different field that they're competing in. But how does what you're offering there at MyOme, you've kind of described some of that, how it strengthens patient trust instead of creating this anxiety or confusion. What does this responsible implementation look like in a practice? If it talk to us a little bit about that.
Yeah, so again, we make it very easy for people to order our tests. We have a portal that's very easy to use. It's not a bunch of words. It's not flip through 20 pages. We've made it very clear that this is what you order. This is what you do. In addition to that, we're working with companies like Nest Genomics. We partner with on an announcement we made with Miss Medicine and Lisa Larkin's large a number of clinics to easily convey results back into a medical record. And we're talking to other groups, EMR vendors as well, to easily convey those results. And then, the last thing we're doing, which I'm actually very excited about heading into 2026, is the use of AI. And so, I mentioned so far that clinical factors play a role in understanding your risk. But why limit yourself to just the clinical factors that, have been historically done for 40, 50 years? LDL, triglycerides, et cetera. There's an enormous amount of information in your health records that could contribute to that risk. And, we'll be announcing very soon our efforts into this space, whereby we're combining much more data on someone and integrating it. And then working with these companies, these concierge practices to easily ingest that data so that it's seamless to them. They're not they're entering dozens of different values. Yeah, how do we hit a button, take all that information in a responsible, secure way, and return a result that is clinically meaningful, that inserts directly into your workflow, and you can go about doing what you should be doing, which is taking care of the patient.
From what you've seen in working in currently in concierge medicine, but also elsewhere, what separates practices that use this really well from those that just don't?
Well, I think the first step is you to using it. It sounds sort of basic, but there are people who are going about practicing medicine in a robust, strong way. I'm not going to criticize that, but they're using technology that's not in the they're not using the technology that's available to them that can meaningfully make a step function. So the first thing is using it. Because what you find, and this is why I think it's so important the way we're going about this, is that once you use it, you'll realize that you're not doing anything different in your practice. You're just getting a better result. You're getting a more accurate result to still do all the things that you would do downstream normally. And I think that's the barrier. And where we get a lot of excitement when we speak with concierge groups and concierge physicians is that they take the time to go, I get it. I understand that, if I order this for my patients within, a couple weeks, a few weeks, I'm going to get a result back that I can act on. This is clinically actionable stuff. And it's not something that I would be doing abnormally as part of my current practice. I'm going to suggest imaging. I'm going to suggest medication. I'm going to suggest this or that. It's just a better result. It's another variable that I think that is incredibly powerful that gives me an accurate result.
How are these top tier, we're kind of shifting gears a little bit. How are the top tier clinics that you're working with really, they get it. They're integrating
Mhm.
these insights, these prevention programs into nutrition, having these conversations about lifestyle, medication management without really overwhelming the patients. What do you, tell us a little bit of maybe a story that comes to mind?
Yeah,
I'm sure is one of many.
there's one of many, but I'll tell you a story about a longevity doctor who we approached. Owns his own concierge clinic. If you walked into this guy's clinic, he is a model of health. Probably in his 40s, incredibly fit. Does everything you would to prevent cardiac disease. He had, family history of it, but fit, eats healthy. All his numbers look great. He monitors them consistently. So we said, why don't you give our test a try? He was very skeptical and that nothing this is not going to really change the way I operate, operated myself effectively. He got his result, and very similar to me, he got moved up to the close to high risk, threshold, 20%. It was like 19.5%. He was flabbergasted. He poked and probed to like, is this number real? Blah blah blah. And we showed him the studies, and we showed this is why it's real. He changed the way he lived. He got started on medication. He got started on I think two different types of medication. Now, what's interesting is because he got a whole genome analysis from us. As part of that, you also get a medication response report, pharmacogenomics, telling you whether you will be able to easily metabolize or there are no side effects for a particular medication. He then used that as a reference and said, okay, I'm going to want to prescribe these two medications. All right, they're good for me. So I feel confident that they'll work. So he ordered those. He eliminated any single gene analysis. We provide that as well because we're all whole genome. So there's nothing like FH or anything like that that's incredibly severe. So this was a lifestyle change for him, and he made this part of his routine. And we get emails from him all the time, basically saying that this is amazing. And so that's how now he's incorporating that into his entire practice and telling people that look, I'm the perfect example. You would never have thought, but I was a ticking time bomb, and now I'm on a path whereby I can manage this in a way that's responsible without doing anything drastically different.
Yeah. Yeah. I remember this. I'm an overthinker by nature. I think in the last 7 years or so, I've really become an overthinker. And so when I think about medical education, I think about this utility, I think about how this can really influence a physician's decision making in today, tomorrow, forever, if they're using it in the right, responsible way. When I think about education, I remember interviewing a fellow Ph.D. of probably someone and she said, not only speaking on education, she said, not only is it going to take an act of Congress to change how we educate physicians, it's going to take an act of God too. And that was pre-COVID, and now we got all of these things that happened within the pandemic era, and some things have been really great, some things have not. It would make sense to take this type of education, the genomics education, to take this type of knowledge and put it into more medical training, medical education outside of just CMEs, outside of just conferences, which can look at, from afar, like sales pitches or those, how do we take what you're doing and get it into those spaces and places where this becomes, kind of not a standard of care, but like, okay, I'm an expert in these areas, and some maybe it's specialties, but just riff on that a little bit. It's a big picture question.
Well, I think it starts in multiple places. I think one is obviously medical education. You alluded to that. And I think more emphasis needs to be placed on this in medical school and how you can integrate genomics into various different use cases. I think spending time on that, it starts there. And I am seeing a lot more younger physicians who are graduating who are more receptive, more open to this. And maybe it's because through education, or maybe it's just being around newer technologies that's giving them that mindset. That's number one. I think number two is getting over the fear factor. We've talked about that. All right, like is genomics scary? It's hard to interpret. I can't do it. I can't put it in my practice. So that's hurdle that we really worked hard, and I know others are as well to overcome that by providing genetic counseling, by making reports easy. I think that's the second piece. And I think thirdly, you have to work with very smart KOLs, and which we do. I mentioned Dan Rader at UPenn that we worked with. We have a publication with him for our coronary artery disease test. We work with Pradeep Rajan at Mass General, who's the head of preventative cardiology there, and other KOLs as well in this space. They're the ones who are going to really bring this to the masses when it comes to their peers and their physician groups. They're the experts. They're called KOLs for a reason. And so I think it's going to take all these things. It's not going to just be a single thing. And quite frankly, it's going to also require the technology, good folks, to keep reducing prices, to make compute easier. All these factors have to go into play to really bring genomics to not just I'd be reminded to do it, but it's just part of what I look at. Just like someone looks at LDL and HDL and immediately says, "Oh, you're at risk." No, the answer should be, are you integrating your genetics into it? Because that's a big variable as well. I think we're moving in that direction, and I've seen considerable progress just in the last 3 years. We've been having a very different conversation 3 years ago, or 4 years ago. And I think we're moving in that direction, especially if you look at the engagement we have had and the uptake we've seen. We're certainly moving there. And as I said, I'm an optimist in that way.
And that you kind of jumped on my last question. So if you've already kind of answered it, you feel free to just add one or two tidbits to it. But looking ahead 3 to 5 years, what shifts should concierge practices, membership practices prepare for as what you're doing becomes more mainstream in primary and preventive care?
I think we see a lot of concierge practices who are very open to this. I think where these networks and a lot of these big programs get caught up is trying to do, massive evaluations and try to push everything down to their members. Look, I always say start small. Get engaged with us. We'll get the first reports out to, let's call it, a handful of clinics, and see where that goes. See how it works. Then let's expand. I think a big part of this is everyone wants to do everything big to start. Even with the Catalyst program down in Alabama, it's been going on for about 7 months now. But just now is when we're starting to see a massive uptake. And it's because it took time to work out the operations and get people comfortable. And once you do that, that's when you see it. So don't try to bite off more than you can chew out of the gate. And also don't wait for that, because other things take a year, 2 years. If you start want getting into, oh, how is this going to work? Edge cases. No, let's identify 5, 10 clinics where the people want to do this. People are eager to do this, and then they can start sharing their experiences, the early adopters, with the rest of their cohort and their colleagues, and that's where you see rapid adoption. But this idea of doing everything big to start, that's where I think companies and organizations like large concierge practices get mired in details and weeds, and really, it takes much longer than it needs to.
Start with a couple patients, get familiar with it. Is that what I'm hearing?
That's it, right. That's right. And so that's how we engage with concierge practices. Let's start with half a dozen clinics. Let's then expand from there, because those early adopters will speak the virtues of it, and it'll be a lot more comfortable and easier. It's a lot easier for physicians to hear from other physicians and hear from me or my team. And they hear from other physicians. I use it, and these are the patients, and these are the use cases that we've used it on. Here's how you can treat your patients. This is how I did it. And this network effect. We launched a network with early I think 8 early adopters on this, concierge networks or individual clinics that are large. And that's the goal, is to share insights. It's to get together frequently and talk to our chief medical officer or our clinical team, ask questions. How do I do this? I got this result. What do I do? They share ideas together. We share ideas with them, and that message continues to resonate across the industry. So I think, as I said, I'm an optimist. I'm really excited about the year ahead, and the years beyond that even. And I see a lot of folks in the concierge space engaging with us, and they're all good people. They all want to do best by their patients, and this is a great way to do that.
One, our final kind of question and topic is engagement. How are they, if I'm a physician listening and I'm going to be on two pathways. The first is I'm interested. I really want to learn more, but I don't know a lot about this. Like I just maybe converted my practice over to a concierge or subscription-based healthcare delivery model. And, you know, I'm by no means an expert in what you're doing. So how do I start diving in, start learning, is there training, educational programs, conferences, events, these different things. And then the other pathway is, yep, I'm on board. How do I get myself, my patients, and my practice onboarded?
Yeah, well, I look, there are obviously conferences and networking events that people go to, and they can learn there. I don't know how much genomics is talked about at those conferences. I know that, there are specific conferences where that is an agenda item. I would just ask people to reach out. And I know that sounds more like an ad and a commercial, but the reason why I say that is because when you talk to us first, you talk to clinical people. You're not talking to salespeople. We want to make sure that you're comfortable with the science, with the practice of medicine and how this works in your practice. The economics and all that stuff we can work out, and we will work out, and we worked out for many people. I'm confident we can get there. But first thing is talk to the clinicians, talk to the people that know how to treat patients, because that's the similar goal. And even if you spend half an hour with our team, I can guarantee you that you'll come away both impressed but also more knowledgeable about the states. And if it still takes you a little while to get comfortable with it, so be it. But that first step is step in the right direction. In terms of, you're ready to go and that's the second flow, and how do you do it? Again, we make it very easy for you to get set up and get going. There's very little paperwork involved. You're the physician, you order it through our portal to start. You can get going in a matter of an hour. It's not hard. So I hope what you're hearing is that we want to make it easy for people to do this in a clinically responsible way, in a way that allows physicians to take care of their patients in the best way, but leveraging the power of this technology that is so profound and can make a meaningful difference in so many lives.
Wow. Well, this has been a very powerful conversation, and not just because it's innovative and it's, been around for a little while, but it makes me as a dad, as a patient, as a, father, as a sandwich generation caregiver, but mostly for my kids that, you're leaving healthcare better than how it found you. And that's my mission and vision for what I do. And, it's rough out there. It's tough out there. And being a patient, being a physician, being behind the scenes in what you do and educating physicians about things that are moving the needle forward for patients, that's encouraging. And I'm excited about what you guys are doing over there at MyOme. And used responsibly, this is going to be great with every physician that I think uses it. And this is not an advertisement. You guys aren't paying to be on this podcast. We just feel as though that this is education, information that our physicians, our listeners need to know about, because it is no longer about being the best doctor in the world anymore. It's about being the best doctor for the world, for your patients, and for your local community. And that's the conversation. That's the hill that I think, I wish more physicians would, be standing on. So two last questions we have for you. Well, actually, website is myome.com. Am I correct?
Correct.
myome.com. We'll put the links in the show notes as well. So what's on your nightstand as far as reading, Audible, playlist? What are you reading that you would make? It could be more clinical, it could be educational, it could just be for pleasure
Sure.
reading, or both. We ask that of all of our guests as well.
Yeah, it's fascinating. What I've gotten really interested in lately, and just combination of books, podcasts, and listening to thought leaders, is the implications of AI in healthcare. And now everyone says that, and I know everyone talks about AI. And my wife's heavily involved in AI, but I'll tell you what, I've always had this thesis for several years, that if you think about healthcare, everyone gravitates, I shouldn't say everyone, but a lot of people gravitate towards what I call the sexy part of healthcare, drug development, and using AI to find targets. And how can AI be used to do that? I still think we're playing in the realm of reactive medicine when we do that. By definition, when you start using drugs to treat disease, you have already manifested the disease. I believe there's tremendous opportunity. We're using AI to prevent disease, to delay disease. Not to get political, but you talk about what the MAHA movement, America Healthy Again movement is about. At its core, really is about just delaying disease and preventing disease. Now, who doesn't want that for people? And we can argue about the mechanisms by which we go do that, and how we do that, but that's really the core belief of what I think the power of AI can really help with. And we're demonstrating. How do you use AI to give people an accurate risk assessment, to prevent disease, to delay the onset of disease, make them live longer? And that to me is really exciting. I think we're not just scratching the surface. I don't think there's been enough attention put using AI for these purposes. And so that's what I'm really fascinated about, hearing smart people really think about this. because I do think this is all going to come together here over the next, let's call it 12 to 24 months. I think you'll start seeing meaningful change, leveraging this great power and technology that humans have, unearthed.
Well, it's a kind of an interesting, you know, thought, because as a patient, I know that there's a frustration factor happening in medical offices, especially among the physicians communities, that's frustrated that patients are no longer printing out Google sheets, about what they found and asking their doctors about it. Now, we're getting our information from this influencer, and we're talking to this genomics company over here, where patients are equipping themselves much more than they used to. And that's not going to change. They're only going to equip themselves more and more. Yet there's kind of this animosity maybe within the healthcare community that's like, well, you can't trust it. We don't know it, to quickly dismiss those things, but also still see themselves maybe a little old-fashioned that, well, we are the center of the universe as their physicians, but yet we know we don't work in a relational model that can really work well for this. So interested in, about how AI, those types of things, what, your experience with.
Yeah, sure. I'll give you a perfect example. I was in my physician's office last week, and she knows my case. She's been treating me for 15 years. She knows exactly where things have gone. She knows my numbers very well. She popped open evidence. And she's like, well, let's just ask, because I was telling her I was taking the supplement for heart health. And she's like, well, given where you are and giving your numbers and film history, let's see if it makes a meaningful impact. This supplement does. So she opened up open evidence, typed in 49-year-old male with family history, blah, blah, blah. Here are the numbers. Would they benefit from this supplement? And it cited everything, and studies and this and that, and said the conclusion was, and we discussed this. She's like, look, given the fact that the supplements can impact liver enzymes, is it worth it, right? Given where you're doing with the statin and everything, this probably doesn't make a big difference, and if anything, it'll do more harm than any benefit you may get from it. So I stopped taking the supplement. That's real the power of AI, right? Where like instantaneously she was able to mine God knows how much data and say, for this person, I can do this. I did the same thing. I got my CT angio results back over the weekend. Obviously, no physician was available, no cardiologist was available. I just wanted to understand whether I'm okay. I uploaded that to ChatGPT. It has all my numbers and everything. And I said, what's my care plan? And they're like, oh, everything looks great. You're at about a 6% risk right now, just given all the genetics and everything. One thing we should take a look at is your blood pressure. It's starting to creep up a little bit, your diastolic blood pressure. So why don't you talk to your cardiologist about that? And that's exactly what I'm going to do. And my cardiologist is not going to look at me going, why did you use ChatGPT? They're going to go, interesting. Now let's figure out what we can do. Do I get started on a blood pressure medication? No. Do I do this? Or just monitor it for a year at home with a smart monitor? That's the power of AI. That's the power of technology. It's a conversation. It's a dialogue with your physicians. This is not going to fully replace physicians. The good physicians are going to use this technology to do better for their patients. And that's what I'm really excited about, is that you have all this information. I've learned more about myself from AI algorithms in the last week, right, than I ever could have in a 30-minute conversation with my physician. And
Yeah.
she knows that too. And that's really exciting for her too, that I'm taking better care of my patient with this information.
That's awesome. And I'm so glad to hear that there are physicians out there that are doing that. Because, as a father, that's what I want my doctor to do for my kids when they're off on their own, going to these visits, and they're not under our house, our roof anymore.
Correct.
And because I want them to live a whole lot longer than, our generation will. So anyway, thank you so much for being our guest. We'll put the links to MyOme and how to get connected as well in the show notes below. So thank you so much for being our guest today. And I'm looking forward to hearing more and more about what you guys are doing in the future. So thank you so much for being our guest.
Appreciate it. Thanks for having me, Michael. Appreciate it.